My name is Zach Delpra, and I'm a Senior Associate at the Crime and Justice Institute at Community Resources for Justice, and I will be moderating today's webinar, Assessing and Improving Treatment Quality. To begin, I would like to tell you a little bit about CJI. CJI provides nonpartisan consulting, policy analysis, and research services to improve public safety in communities throughout the country. CJI helps and promotes evidence-based practices inform practitioners and policymakers, including corrections officials, police, courts, and political community leaders to assist them in making criminal and juvenile justice systems more efficient and cost-effective and promote accountability for achieving better results. On 21st, CJI hosted a conference in Sacramento, California entitled Measuring Realignment Using Data for Management and Evaluation at the Local and State Level. The purpose of this conference was to assist key criminal justice stakeholders in California in their implementation of Assembly Bill 109, the Public Safety Realignment. The person you're about to hear was one of the conference breakout sessions. So without further delay, it's my pleasure to introduce today's speakers, Rachel Lizon and Matt Davis. Rachel is an analyst for the Utah Administrative Office of the Courts. She worked in the program evaluation field since 2004 and was part of the team that implemented the correctional program checklist in the juvenile justice system in Utah. Ms. Lizon specializes in research in juvenile delinquency, child welfare, and adolescence. Her research on adolescent social groups and peer rejection was published in Within the Social World, Essays in Social Psychology. Her research has also been presented at national and international conferences. Dr. Matt Davis is a research assistant professor with the Utah Criminal Justice Center. His work focuses on developing practical evaluation methods for improving the quality of social service programs, innovative methods for training mental health practitioners. He has over 10 years of experience working on projects for deciding and implementing evidence-based services in juvenile and criminal justice. These employ both qualitative and quantitative methods. Projects include Children's Bureau, National Institute of Justice, Utah Administrative Office of the Courts, Utah Division of Child and Family Services, Division of Juvenile Justice Services, and Utah Commission on Criminal and Juvenile Justice and nonprofit agencies. In addition to his research activities, Matt is a practicing clinician who provides psychological assessment and therapy to children, adolescents, and adults at the University Neuropsychiatric Institute at the University of Utah. He received his PhD in counseling psychology from the University of Utah. So with further ado, let me turn it over to Rachel Lizon.
Thank you. Good morning. This is Rachel Lizon, and I'll be presenting today with Matt Davis on implementing an effective program evaluation process. There are a number of objectives of program assessment that make it important. The first is that it provides information on whether programs are effective in using evidence-based approaches. One of the challenges working with providers is that each provider indicates that they use evidence-based practices. However, how do you know if this is occurring? An effective program assessment approach allows you to determine if programs are using evidence-based practices or simply using the terminology that suggests they are. The second is it helps assist programs in learning how to serve offenders. Oftentimes when working with programs, we find that there are clinicians from a wide variety of backgrounds. Sometimes this is education or other areas, and so they're not as familiar with working with offenders. So one of the objectives of the program assessment process can be to train them and teach them how to work with offenders specifically. The third, establish benchmarks and measures of annual progress. One of the things that we found as we work with programs is that oftentimes they don't stay stagnant. They're either improving or they're not doing as well across years. So program evaluation allows us to really look at which direction they're headed. And the fourth thing is it promotes accountability based on actual outcomes. We found in our state that there are some programs that are very successful at presenting what they do, while others really struggle in more of that media interaction. However, the program assessment process lets us look beyond that and see how they're doing in the actual program. Look at why program quality matters. There's been a number of different studies that examine this issue. One is the Washington State Institute of Public Policy that shows not only does program assessment affect the individuals in the program, it can also result in great cost savings for the community and for the public. When we look at effective programs, these cost savings can be quite large. And so this really is an area that can be a benefit not only to offenders, but definitely a benefit to the community, both financially and in reductions in future crime. Look at the assessment process overall. In Utah, we use the Correctional Program Checklist, and this is a program evaluation tool, and it's developed from research on evidence-based practices. And each of the items on it is correlated with reductions in recidivism. It also covers three main areas. The first is what's worked in the program. The second is what needs to be changed, and the third is what are the recommended steps for improvement. The program checklist is a structured interview for you administer with each of the program. It also includes observations. It includes reviews of files and the curriculum, and it usually takes 1 to 2 days. There's 77 different items on it in 5 domains. The first is leadership. There's also staff, quality assurance, assessment, and treatment. All the factors on it are correlated with reductions in recidivism. How the process works itself is that the trained assessment team conducts a site visit with the program. So you go to the actual program, and then you conduct structured interviews, case file reviews, observation, you review documents, you do an evaluation of the fidelity to the model, and the program is then scored after that site visit on a set of indicators. After that scoring and the writing of the report, there's a feedback meeting with the program to discuss goals for the year and what is going well and what needs to be changed. And in our state, we use another essential tool, which is an interactive website that shows the results of the program assessment, outcomes related to the assessment, such as recidivism, and then also areas that the program needs to change, as well as technical assistance. And we'll discuss more about this later in the webinar. The finding is that the programs are reassessed annually or more frequently if necessary. If our programs are doing well, we reassess them on an annual basis. If they're struggling, we may visit them more often to make sure that they're making the progress that's essential. So assessment can tell us a number of things. First, it can compare the program to a norm or standard. This is very helpful to let us know where our programs are at. Second, it allows us to compare across our programs. We provide a wide variety of programs, from substance abuse to programs for offenders who offend sexually, and to be able to compare a substance abuse program to a sex offender program is very important for us, because we do have a variety of different types, and this tool allows us to do that. We can also examine the program's progress over time, so we see whether across years they're improving or they're declining, and whether they're actually continuing to use evidence-based practices or they have slipped in that area. And then we can link the assessment results to outcome measures such as recidivism or reductions in risk levels or risk factors. So this is an important part of not only seeing are they using evidence-based practices, but are they using them in a manner that is effective. Now I'll turn the presentation over to Matt Davis, who will explain more of our online tool and the overall process.
Rachel. Share my desktop now, and hopefully you can see it. Is it showing up, Rachel?
Showing on my map, thank you.
Okay, great. So this is our online tool that we have where we present the results of the evaluations that we're doing. It can be helpful for understanding how we approach evaluations. I shared a little bit about why we developed the tool. We spent a lot of time in developing this because one of the things we found when trying to evaluate how well programs follow evidence-based practices, and more importantly, how to improve them so that they're following evidence-based practices often and incorporating them more is that it's a really difficult process to get people interested in program evaluation and then for programs to actually make needed changes. And so we've put a lot of energy into how do we help them move forward to become a better program, because after all, that's what we're trying to do with program evaluation. We don't want to just know how well the program's doing, but we want to get them to a better spot. And so I'll go through this tool with you, and it'll illustrate kind of the different areas of the evaluation that Rachel's been talking about. First, log on, and I should mention this is a program called Families First. It's an in-home program that focuses on juvenile delinquents, juvenile offenders that have some involvement with the court, but they're not yet placed out of the home. And they've allowed us to show their results in part because this program is actually doing quite well. So we've been evaluating this program for 5 years. First log on, you can see that it takes you to a summary page, and on this summary page you can see the different components of our approach. The first one is looking at, does the target population enter the program? We have these little circles on the side, and that's kind of a stoplight approach to communicating how well the program's doing. So green means the program is doing fine, we have no concerns. Yellow means that there are some concerns and some areas for improvement. And then red means we have serious concerns, and we kind of need to stop and say, okay, how do we change this immediately? Our typical process when we first evaluate a program is not to have all green circles. Usually you see a mix, and it's usually a lot of yellow because most programs have a lot of area for improvement. Getting back to the target population, that's the first step in evaluation. And when we look at the target population, we're basically asking, is the program targeting kids who could benefit? We'll switch over. We've got another tab that shows a little bit of a more detailed view. What we're looking here for is a lot of times when we first go into programs, we'll say to them who could benefit, who should be coming to your program, and there is the general response is almost any kid could benefit, and could take almost any kind of offender. This obviously isn't true from the literature, and if you think about it in a common sense approach, I mean, there's certain types of kids that shouldn't be in certain programs, and programs need specialized skills to deal with certain kinds of kids. So this is the area that we're looking at. This program, we're looking at whether or not the kids entered, and we want to know whether or not they were in the right sanction category, whether or not they had moderate or high risks. So you can see over here on the right side, we have these pie charts, and it shows the kids' risk factors at start. This is the one I'm now is their overall risk, and that's risk for reoffending. You can see that most of the kids are in the high category, which is what we want. And then, just it's a little bit more for this program than we typically want, but kids are in the low risk category. And then we also have the different domains that our risk assessment uses, and we use it's a risk assessment developed by Utah, called the Protective Risk Assessment, and it measures the kids in these different domains. So for each program, we can say whether or not the kids in that program are on average, and you can see the little line there. Hopefully this is showing up well on your screen. It's the average of kids in this sanction that we're looking at for these programs. We can see whether or not the kids fit the average, whether or not they're higher or lower. And what we like to see is when programs say, for example, over here, this is the domain looking at issues that the kids have with alcohol and drugs. if the program was focusing on that, we'd want to see that they're enrolling kids that have issues in that area. And down below, we also look at some of the different demographics so that we can see, what the average age is that the program's looking at, and different things of that nature. So we look at whether or not the kids are coming into the program, whether or not they're receiving the correct target population. Next step is what people typically think about when they think about program evaluation, and that is look at what kind of services does the program provide. That's second here on our summary page, the evidence-based components. And I'll switch over to a detailed view. As Rachel said, there's several different instruments you can use to assess whether or not a program is following evidence-based principles. We've chosen the CPC, the Correctional Program Checklist. This is one reason why we chose it is because it covers a wide range of evidence-based components and principles. It's not just looking at down here. You can see the treatment characteristics. That's usually what we think of when we think of evidence-based components. Think of, are you using a curriculum such as aggression replacement training or functional family therapy or something like that. In addition, the CPC looks at items such as leadership and development. That is the program director qualified? Staff receive adequate training when they're initially hired? Do they receive ongoing training? Are they receiving supervision? It also looks at other assessment. And in this area, we're looking at, does the program measure the kids' risk level, measure their criminogenic needs, so the needs that are related to future offending. And in addition, from the risk need responsivity model, do they look at the responsivity factors that will affect whether or not a youth fully engages in the program. And then finally, I'll need to sound for this. This is the very bottom here. The Correctional Program Checklist also looks at quality assurance. And this is where we're looking at, is the program interested in improving? Do they have measures and ways of measuring what they're doing, and then are they also looking at, like outside providers and how they provide treatment, and is it effective? So we adopted that tool, the CPC, because it examines a wide range of evidence-based principles and components than just the curriculum. And one of the things we found when we first started doing these evaluations is we would give feedback to the program in form of a written report, sometimes a face-to-face interview or a feedback meeting. Rachel will go into this more later, but it was very effective for changing practice. And so what we've done here is we've tried to put basically our written report onto the web. And the reason for this is because then it's always accessible. If we're talking to a program, we can bring it up. We can say, hey, log in. Let's look at this. We can make immediate changes. We don't have to issue just another report, a full written report. We have the ability where the program can go in and drill down and kind of look at, okay, what are the strengths of my program in the different domains. For example, I've pulled up leadership here, and what are the areas in which I need improvement. What this does is it facilitates quicker communication and more interactive process with programs, where it's not just giving you a report, we'll next year evaluate your program and then give you another report. Instead, we're moving to process where we will have this always up on the web, and the tool changes as the program changes. So that's our second step. The first step is looking at whether or not the kids or it can be adults too, but whether or not the right people are entering the program. And the second step is looking at the evidence-based components. Then our third step is where we get to actual change or outcomes. And our intermediate outcome that we look at is the third heading on our summary page, which is we're looking at self-reported changes in attitudes and behaviors. This is surveys that are given to program participants at the start and then at the end of the program, and it looks at self-reported changes. Go over to the details tab on that. What this does is it allows a program to see are they impacting areas in which they want program participants to change. So, for example, you can see here this program has quite a few significant changes. That's what the green circles mean, is that it's a statistically significant change. If it's red, it means it's a negative change, and that's one of the things that we've found in programs that are not following evidence-based practices, is that negative change does, and it occurs, and it sometimes occurs much more frequently than we would want. And if it's no change, it of course is yellow, like the rewards for antisocial involvement scale that I'm highlighting right there. But so you can see here, this gives feedback to the program as to how it's doing in terms of targeting, like in this case, the juvenile offenders' views of antisocial behavior, their views of drug use, their self-reported involvement with antisocial peers, and it allows program staff to know beyond just when we go in and assess whether or not they're doing evidence-based practices, but okay, so what is our impact in terms of, or at least measured from the perception of the participants? I should note here, the first bar, of course, is when the kids come in. The second bar is when kids leave. And then this little dot right here is our state average. We've done with this say that we give with the youth criminogenic needs assessment or needs survey is we've adapted scales from an approach to prevention from Hawkins and Catalano up at the University of Washington that uses a survey that it takes an assessment of all the kids in our schools statewide, so a general population every 2 years. What this does is it gives us a chance to compare how kids in a program are doing compared to the average youth in our state. And not only can a program see are we making changes from beginning to the end of the program, but how do our kids measure in terms of kids on average? Now, with delinquent programs, with under programs, obviously you'll even after change, you usually see that most of the participants leaving are much higher than the state average. But this can come into be helpful when you're looking at more prevention type programs or programs that are dealing with early intervention. That's the third step in our process, and then the fourth step that we get to is looking at outcome that is, of course, most important for at least the funders like the juvenile court or the adult court, and that is recidivism. And down here what we've done is created a method of measuring recidivism on an ongoing basis using a statistical comparison group, and we can feedback then to the program after a certain amount of time, and we get enough participants going through the program, whether or not the participants going through their program are doing better than expected. And, what we found is when communicating these results, the best thing is to try to make it simple so that people don't need to have a grasp of complex statistics or read a whole bunch of charts. And so work goes into creating these two bars. But what we want the program to know is basically, are our program participants doing better than expected, worse than expected, or on average about the same? So that's the fourth component to when we're trying to work with programs and show them their effectiveness and how they can improve. This heading on the left-hand side is the progress on implementing recommendations. And this is something that we've created because we realized if over here at the evidence-based components, there's quite a few recommendations that you can make for a program when you're conducting a CPC. It can become overwhelming, and we want the program to really focus on the area they can get the most change and not get focused and overwhelmed with just areas in which they need change, but not be the major focus. So we've done progress on implementing recommendations, and this just basically lets vendors know, lets programs know, okay, you've really focused on it, you've done a good job, the program is making quality changes, and so let's keep going till the next evaluation. And over here on the right is actual recommendations that we're asking them to focus on. If you see on the evidence-based components, there's a lot of recommendations, but as I was saying, we try to get programs to focus on just the three. In this program, it's doing quite well, so it's only two. And Rachel will explain a little bit more about that when she talks about how we're getting programs to improve. One thing before I turn it back over to you, Rachel, is I just highlighted whether this has an effect. That's one of the things that we're examining right now up here at the university. Is you go to all this effort trying to improve programs, and what we're finding, this is a pretty typical set of results we're finding for programs. This is the program CPC scores over the 4 assessments that we've done. So it's roughly, I think, about 5 years. We use assessments about every 12 months. With the program, it's been about 5 years that we've done the 4 assessments. It's the different areas that the CC assesses, so the leadership, the staff, the quality. I was showing on the evidence-based components tab. What we found is when we first went out and scored this program, they measured 47. And this puts them in I believe it's the needs improvement category on the CPC. Gave feedback. We did a written report. This was before we had done this focus on improving programs. The next year we went out and they dropped 2 points. They tried to implement a lot of the recommendations. In many areas they'd done well. They'd actually become confused, and so we had different directions the program was going, and it was things where we're seeing this across programs, and so we started saying to ourselves, well, what's going on here? Maybe we should look at how we can help rather than simply saying, this program isn't improving. So we started implementing some of the program improvement processes. In addition, I should say this program is very motivated, and so they on the extra mile, so to speak, in terms of finding out things for themselves. But we've begun to see this across other programs, and in the third year they jumped to 71%. In the fourth year, their score was 77. What this means is that they went from needs improvement, the first years, up to the top CPC category, which is highly effective, and the norm group that they used for the correctional program checklist. This was the top 6% programs scored in this area. So significant change we were showing with this program. So that's an overview of our web tools and the rationale for how we use them. Now let's see if I can get you, Rachel. There. Okay, it should be coming back to you now, Rachel.
Okay, Matt. What we saw with Matt, the interactive website, is how effective are our programs and how can they be improved. The interactive process allows us to look at those questions and really answer those questions for our programs. In Utah, before we started this process with the juvenile court, we thought we had effective programs, but we really didn't have a way to know. After this process, we feel quite confident that we can tell recidivism rates for our programs, whether or not they're changing the attitudes and behaviors of the youth, and whether or not they're using evidence-based practices. There's a variety of things we can look at in program assessment, including whether or not those appropriate offenders are entering the program, which is really quite essential. Also using the CPC, whether or not they're using evidence-based practices, those changes in offender behaviors, and then also a major important part we found is that improvement piece. Provide them with effective feedback and then also that ongoing support or consulting. So how do you provide this feedback? When we originally started the process in our system, we essentially emailed them a report that was probably 20 pages in length and encouraged them to implement it. What we found is this didn't result in good feedback from the program or the ability to implement it. So instead, we've developed more of a collaborative approach to let them know that we're focused on ongoing quality improvement, not a one-time assessment, but ongoing support to help them improve. Next, we encourage them to participate in a feedback meeting. Instead of just sending the report to them, we now meet with them and discuss the results together, discuss what's going well, discuss areas they're struggling, and also give them solid recommendations for how to change the areas that they're struggling in. And like Matt mentioned, we prioritize the recommendations. With the CC, there can be many recommendations for the program. However, this can be overwhelming, so instead we prioritize the top 2 or 3 for the program and say, this is what we'd like you to work on. This is what it would look like if you were working on it. We're going to provide you with ongoing support in doing that, and next year we're going to come back and reassess on that. So the last step is providing that ongoing technical support. In addition to the interactive website, the University of Utah Criminal Justice Center also supports our programs by providing that support. So if they're supposed to do a pilot study, they explain to them, what does that look like? How do I do that? How is a research-based way to do that actually applied in my program? The feedback piece is very essential to this process. And we really try to encourage ongoing collaboration between the program and the agency. So we do this through the use of a referral sheet. What we did find, as Matt mentioned, is that a lot of programs would say, we accept everyone. This program can help anyone. But if you're actually a substance abuse program, you may not be effective for everyone. You need to have a substance abuse issue. And so therefore we use a referral sheet so they know exactly who should go, what risk level they should be, what criminogenic needs they're targeting, and how that should work. In addition, we now have our probation department share our risk assessment and case planning information with the program. This allows the program to know what they should be targeting. If an individual is coming in with certain risk factors, it's important for the program to be aware of those so that they can focus on them. The do is also encourage training between agencies and programs on the risk assessment. After we implemented the process for probation to share the risk assessment, we realized our programs weren't familiar with how to read it. And so then we needed to provide the appropriate training so they understand how to read and use and apply those risk assessments. And providing ongoing Data on program outcomes such as recidivism we found to be very important. While the CPC can provide us with important information on whether or not programs are using evidence-based practices, it's also very important to know if that's linked to outcomes. Are they doing it in an effective manner that's actually reducing the risk of reoffending? Another aspect that we've found extremely helpful is sharing successful approaches across programs. So we find if something that's working very well in one program, we'll often ask that program, can we share it with other programs? This is something we'd like to use as a model. And most programs have told us yes, and this has been extremely helpful. It means that when we have an effective approach, we can export it and use it across programs. One of the things that makes this very useful is that sometimes our programs have very limited resources, and being able to export efficient and effective ways to do things reduces costs. So with this all together, what we is that evidence-based practices, we know we need to use a validated risk assessment with our offenders so that we know we're targeting modern high-risk offenders. And we know we need to develop a case plan based on that risk assessment and identify specific risk factors. Then we match the offender to effective services based on those specific risk factors. Then we enter the program assessment process, and what we found is that we integrate the program evaluation into the entire process, first with the RFP and contract, and using an annual assessment, then providing feedback to the program, then providing ongoing technical assistance, and then measuring those outcomes. And the process repeats itself. So this is an ongoing quality assurance process, not something where we do it once and then the programs don't see us again. It's something that's integrated across the system and pairs directly with evidence-based practices across the system. So an understanding of the program assessment process, where do we go from here? How do we get started? The first that we learned was that we really needed to prepare in a number of areas. The first was within the organization. What we found is that we really needed the support of key decision makers. Oftentimes with program assessment, you may not have the support of everyone. Having the support of key decision makers is very important for the process to be effective. Then establishing how the results will be used and shared. This is something that we learned after we'd done a few assessments, was that people really needed to know who has access to the information, who will it be shared with, and how will it be used. The next was developing a process for addressing a low-scoring assessment. When you assess all of your programs, chances are at least a few of them will score low on that assessment. What does that mean? How does that affect funding? How does that affect your ongoing relationship with the program, and who gets to know that the score was low? So developing that within the organization before starting is very helpful. We also found we needed to do a little groundwork before starting the process. Just as programs really wanted to know what will we be assessed on. They also wanted to know how will it be used, what's expected of them, and then also will they go in collaboration and quality improvement. And then also training them on effective principles for working with offenders. As discussed earlier, some of our programs hadn't really worked with offenders before and needed to receive additional training and support in the area of working with criminal offenders and the What Works principles. Laid that groundwork. The next step is really picking your team. And there's a number of things you want to look for in picking your team. The first I'd recommend is expertise in evidence-based approaches for offenders. If us on the team is going to be evaluating programs on evidence-based approaches, it's important that they understand them and know them well. It's really useful to have someone with clinical experience with offenders. Everyone on your team needs to have clinical experience, but at least one person is very useful to have. We learned this through practice is making sure that the assessment team is somehow independent or in another department from those who refer kids every day and work with kids every day. It's important that they can have that objectivity and be separate. And oftentimes with program assessment, you have to give some difficult feedback, and so it's important to have that separation. And that leads into our next point, which is really more of a stylistic thing. Look for an individual who has the ability to collaborate while having difficult conversations. So looking for someone who can have that challenging conversation of these are the areas we'd really like you to improve in, and these are the expectations, at the same time doing it in a way that doesn't destroy that collaborative relationship, and yet incorporates the idea that expectations will be met. Next is a graduate level degree or extensive experience. This is not something you would want to have someone new to the field doing. It's really something that experience and some expertise are really quite essential. The last item is interest and support of the goals. Everyone on your team really needs to believe in this process and have interest in doing it and believe that programs can improve. With it may be very difficult to get the buy-in of the programs themselves. So your team, how do you train them? I can explain the training process in Utah. It may vary a little bit for your state. So this is based on our experience, and you might want to look into this more deeply in your state to see what's available at this point in time. For ours, we would recommend using a certified and experienced trainer. In our case, the training lasted 3 days, and we were able to have 10 to 15 trainees. I would recommend training more individuals than needed. What we found is that there were certain individuals after they went through the training, either from them or from those who were doing the training, that maybe it was not the best fit. And so training a few more will allow you to handle the issues of possible attrition. The next item is selecting a program for the training site. This is actually an important element of the training. I recommend picking a program that is quite strong and that can handle a large group. Having 15 people come in and even train on being assessed on your program can be quite stressful. So picking a program that you have a good relationship with and it's doing quite well can be a positive thing. That being said, we do not publish the results of the assessment from our training visits because they're often less valid because the individuals are being trained on the process and they need to go through that training. Last is complete refresher training. It's important to make sure that we as program assessors are maintaining maintaining accuracy to our model. So therefore, it's important that we go through refresher trainings as well. Is the initial evaluations. I would recommend that the assessment teams include at least 2 evaluators. Preferably one of them should be experienced in using the CPC or the assessment tool you're using. If you don't have an individual who's experienced because the process is new to your jurisdiction, I recommend having 3 evaluators. I'll want to monitor ongoing inter-rater reliability. It's important if you have multiple teams that those assessments are consistent and there's fidelity to the model across the assessment teams. Next item is providing ongoing training on effective interventions to the members of the group. If we expect programs to use evidence-based practices, it's important that the assessment team be up on what the most current research is on those evidence-based practices. And the final item that we have found successful is partnering with local universities or centers. This allowed us to access a lot of expertise that we couldn't maintain in-house, and yet has been a major benefit to our programs. We have found there are a number of structural changes that we needed to make for our assessment process to really be successful. We started writing the program assessment portion into our request for proposals or into when we request for providers. And what we found was that this way they knew upfront what was expected of them. The step of that was then we incorporated the same process into our contracts. Programs knew coming in, this is what's expected, this is ongoing, and this is kind of the way the system works, and I will be expected to be a part of this process. This has helped a lot with buy-in. Having a web-based tool to provide feedback and monitoring, as Matt illustrated, this has been extremely helpful for us. In state, our programs are quite spread out. In other jurisdictions, it may be an issue more of the number of programs, but that web-based tool really increases accessibility. Next we found very helpful is automating our data process for the outcome data. Making sure that the process of obtaining recidivism data is something where we've established the protocols and it can be ongoing and doesn't require a lot of work to do this on an ongoing basis. Valuing interventions prior to implementation. This has been one that's been extremely helpful to us in that now before we start a program, we examine whether it uses evidence-based practices, whether it's worth the effort to put all of resources into starting a program to see if it will even have the ability to be evidence-based long-term. The final is implementing policy changes to allow information sharing such as risk assessments. In our case, we had to do a rule change to be able to share those risk assessments with our providers. But that was also an essential part of making sure that providers were aware and probation was aware of whether or not the they were serving were higher risk. The final part of getting started is adapting the process to your jurisdiction. Jurisdictions vary widely. There are a number of different ways the program assessment process can be adapted to a wide variety of jurisdictions, whether they're small or large, whether they're spread out or quite small in geographic area. One of the things that we found helpful is the pre-PCs, the evaluations we do when programs start, so that we can identify programs that are worth really investing that long-term resources in. The next is, oftentimes when we first evaluate a program, we'll go out, we'll do the entire assessment process, we will score the program, and we will give the program feedback, but without the official scores. We score those, we keep those, but we don't necessarily always give them to them. It helps them sometimes focus more on what they need to change and less on that absolute number score. This year, we provide them with the information and the scoring. What we've really worked on is the electronic and automated web reports versus written reports. In some jurisdictions, it may be easier for you to create a written report. Have few programs, or that may be what your resources allow. In larger jurisdictions with many programs, an electronic or automated web reports and report writers are probably something that will be a better option for you. And the item is on-site feedback meetings versus phone or online meetings. If you have just a number of programs in a small jurisdiction, you may want to go do face-to-face feedback meetings with them. If you're a large jurisdiction with many programs, you may find that phone feedback meetings or online feedback meetings are more effective. That being said, we do find with our programs that are struggling and really not doing well, oftentimes a face-to-face feedback meeting is most effective. So once gotten started, how do you make the decision on selecting your assessment tool? The assessment tool we've selected is the CPC. However, there are many tools out there. Some of the strengths of the CPC is that it's based on research on empirically tested items. We also found that it applies in multiple program types. So once again, we can use it with a substance abuse program, a sex offender program, and a general program that addresses criminal behavior. Also provides rapid feedback. We can get feedback on a program within a few weeks. In addition, it establishes those benchmarks of progress across time. We can say if a program is doing better than 4 years ago or worse than 4 years ago. Also, in our state, we found it to be very cost effective. For us, the main cost has been in the salary of the assessment team. It identifies how to improve. One of the challenges we found in past program assessment approaches is that it tells us what the program is doing wrong, but it doesn't necessarily give ideas on how to move forward from there, whereas this tool does. However, CPC assessment tool also has some limitations. One is that we have not found it to be appropriate for interventions that provide only individual counseling or specifically only family counseling. Also, the quality of the assessment team will affect the quality of the assessment. So the tool is not self-scoring. An assessment team is scoring it, and so it is important to a quality assessment team. The third item is that it does require site visits. It is necessary to go out to the program and to do a site visit at the program. It's not possible to do the program assessments from your office. The fourth is that in our case, it did not replace financial audits. The CPC is not a financial audit tool. It is a program assessment tool. Those are two different things. And the one is it does require training. This is not something we would recommend someone using who has not been trained on it. And it really is essential to have training to use the tool in the proper way. How do you select your assessment tool? There are other options. The correction program checklist is only one tool, and there are other tools that are available. It would be expected that each tool, though, has its own set of strengths and limitations like I've outlined for the CPC. And then the selection of that tool should be based on what best matches your jurisdiction needs. However, the overall process is going to be similar regardless of the assessment tool you select. So the overall process again is once again using a validated risk assessment, developing that case plan, matching the offender, and then integrating the program assessment process into your RFP, evaluating annually, providing feedback to the program, providing ongoing technical assistance, and then measuring outcomes. So whether you select the CPC as your assessment program assessment tool, or if you select a different tool, this overall process really is quite similar. So we'll start. First, we recommend selecting a program assessment instrument that is research-based and matches the needs of your jurisdiction, whatever those may be. The second is selecting an assessment team with those characteristics that we discussed that are most likely to be effective. Third step is setting those internal protocols for how assessment results will be used, informing programs and letting them know what those expectations are prior to that first assessment. So letting them know, what will this process look like? What will it mean? What could the possible outcomes be? Training and beginning your program assessment process would be the next step. So making sure that your people are well trained and that the process begins assessments of each of your programs. That followed by collecting that outcome data and linking it to your assessment results. Develop standardized technical assistance and their effective approaches across programs. This is where in our online tool, programs can actually access information on different topics such as appropriate rewards and punishers, appropriate exclusionary criteria, things like that, so they understand how to do this. The next step is adapting the process to your jurisdiction size and needs. So we mean that you'd use a lot of automated electronic reports versus paper reports, or web-based feedback versus in-person meetings. And this is implementing protocols to ensure inter-rater reliability and the validity of the assessments. Program assessment process is very important to make sure that the raters themselves and the assessors themselves are following the tool. Overall, this explains the program assessment process and how to effectively implement it in your jurisdiction. The assessment process we have found is something that it doesn't happen overnight, but it also is extremely doable. It is something that we can do, and that we know the effective approaches that work, and we can answer those questions. How are programs doing? Are they using evidence-based practices, and are they effective with offenders? We appreciate your time, and we'd be happy to answer any questions you have via email. Thank you.
Thank you, Rachel and Matt, for the useful information, which I hope will assist agencies not only in California but across the country, or whoever views this webinar, in improving their own programs. I also want to thank Kristen Nielsen from CJI for all of her work in coordinating this webinar. And for the participants, thank you for your time and attention.